Hello everyone, welcome back to class. This is section 3 on autism. So this is, if you're looking, then this is part 2 of the slides that I posted. And today we're going to talk about neurobiology and connectivity in autism. So we'll go over some of the neurodevelopment risks, some findings we see, some changes and differences we see in the brain itself, as well as talking about some possible causes, but most of those will be in later videos. So, we're going to talk about all the risks. Now, the main thing to know when talking about autism and all the possible risks that can lead to autism is that it is a neurodevelopmental disorder, which means most of these risks are occurring prenatally or perinatal and early in childhood. So a lot of these risks seem to be a little more, I guess, biological risks, or like infections or complications from different things, and less having to do with the environment. But remember, the environment does still play an important role in kind of activating these risks. So first, let's talk about the prenatal risks. So the main thing is that prenatal exposure to anti-epileptics, antiemetics, and abortifacient, those are a big prenatal risk. In other words, if the mom is taking medication for epilepsy, other diseases, or attempted to abort the pregnancy, then this can lead to neurodevelopmental issues. We also see a lot of prenatal risks associated with gestational diabetes and bleeding. If there are multiple births as well, so like twins, triplets, that kind of thing, then it's more likely that at least one of those babies will develop autism. Also, firstborn compared to third or after, the firstborn is more likely to have autism, but of course siblings of a child with autism also have an increased risk. And then maternal or paternal immigration. So there's a marked increase in male children born in urban areas. And then the last one I want to talk about is folic acid. So there is a debate on folic acid as either an increased or decreased risk for autism. Many early reports do suggest that folic acid supplementation after conception will increase the risk of autism spectrum disorder. Well, some recent well-controlled studies show that folic acid supplementation at the time of conception may actually decrease the risk for autism spectrum disorder. So folic acid is one of those things that's very highly debated. Again, older research says it increases the risk. New research says it decreases the risk. So we're not fully sure what's happening there. And just remember that there are many possible interpretations of all these prenatal risks, which may suggest epigenetic mechanisms related to the biological and psychological stresses that come along with gestational diabetes and bleeding. There's obviously some stuff going on with the body, but that can obviously lead to psychological stress as well about worrying about the fetus. So then, once the baby is born, then we have perinatal risks as well, so during the birth. And so there is some suggestion that prematurity is an increased risk of developing ASD. as well as some sort of abnormal presentation. So that'd be like a breech birth, so like feet first instead of head first, like it's supposed to be. Again, has been associated with an increased risk. Cesarean section is another kind of debated risk, similar to folic acid, where cesarean sections have been debated whether the delivery as an independent risk factor, as many of the data sets used are confounded by the fact that a breech presentation is both a risk for autism and a common cause for cesareans. In other words, a lot of times mothers that give birth cesarean, that's an emergency cesarean because their baby was in a breech position. So is it the breech position that's the increased risk or the cesarean? You know, there's not a clear division between the two. And so there have been some studies controlling for the breech position. And these studies say that cesarean delivery does not significantly increase the risk of autism. So it seems to be more this abnormal presentation rather than a cesarean section that increases the risk. And then, of course, there are multiple other perinatal risks that all kind of fall out under neonatal hypoxia. So I'm going to let you guys read that, but just know that there are a lot of other perinatal risks. So really any sort of complication happening during this perinatal time has been associated with an increased risk in autism. Now I'm sure you were hoping that's it, but nope, we've got even more developmental risks. We have probably the most associated risks with autism. Oh, something just happened. Most likely because we don't really understand what is happening as much with autism. So now we're talking about some neonatal risks again. And so here, exposure to air pollution has also been associated with an increased risk. Looking at people that lived close to freeways in California, they had about a 2-time higher risk than people that didn't. And the highest air pollution levels in homes versus the lowest air pollution levels in homes, then you had about a 3 times larger risk ratio for the patients living in a high air pollution home than below. So there does seem to be something happening in the air pollution. So again, that would be an environmental risk or cause. And then we do have some prenatal or postnatal depression. So really antidepressant use during pregnancy can be a risk. So these antidepressant risks may be confounded by the fact that many cases of prenatal depression are undiagnosed, and so the antidepressant treatment groups in these studies may be due to depression and not antidepressants. So again, that's something we've kind of got to talk about. And then another risk would be early social deprivation. So remember we talked about how patients with ASD have some social deficits and kind of lack the want to interact socially. They prefer to play by themselves as children. So there has been suggestions that if a parent deprives early social interactions, and then this may be a risk kind of leading to these symptoms of ASD. But early social deprivation risk comes from studies of children born to institutionalized mothers in Romania. So possibly confounded by other factors, as many of the cases of ASD diagnosed in early development were resolved at later time periods. And low rates of intellectual disabilities were supported. So pretty much, there's been a few studies saying that early social deprivation is a risk, but a lot of these studies, aren't supported nowadays. So more information is obviously needed, and we need to take these with kind of a grain of salt. And then we've got severe sensory deprivation, so congenital blindness, hearing impairment, and impaired vision and hearing can also be associated with an increased risk for ASD. And then in convergent mechanisms, then individual risk factors may result from common underlying causes. So again, epigenetics, the parental age and immigration can have a play. The older the mother, an increased risk of ASD has also been associated. And then again, delivery complications we talked about. And then stress would again be immigration, depression, any delivery complications. And then hypoxia or immune activation. And remember, immune activation is something we talked about in schizophrenia as well. So those are all the risks. There have also been some neurological findings that are associated with ASD patients. And so we do see some cortical enlargement. So macrocephaly by 2 to 3 years old is seen in about 20% of autistic children. So we see this relative increase in the cortical white matter in the frontal lobe, temporal lobes, as well as the limbic structures, especially the amygdala, which again, remember, we do see some emotional deficits in these patients. So that's probably associated with this increased white matter in the amygdala. And then we see structures implicated in social motor and communication functions have also been shown to have some cortical enlargement. So if we look at this image here, then this is a graphical representation of non-uniform growth patterns in the autistic brain. So the yellow areas indicate the outer radiate white matter zones, and then the white zones, which are larger in volume in this study of children with autism than in controls. The white area represents bridging and sagittal components, which did not differ in volume from controls. And then finally, the blue areas were absolutely but not relatively different. So in other words, the yellow areas are showing you where there's enlargement in the autistic children compared to the in the white matter itself. The white area doesn't differ, and the blue areas also do not differ. So it's really, again, we see it in the cortical areas rather than more of that midbrain area. So there are a few specific circuits we're going to talk about when talking about autism. There's kind of three main compartments of functional change in autism. So we've got the dorsal executive control system, which is in red in the image on your right, the ventral social affective processing system in blue, and then the subcortical nodes. So when starting with the red, the dorsal executive control system, so this includes the anterior cingulate, dorsolateral prefrontal cortex, the caudate nucleus, the dorsal striatum. All of these areas are associated with restrictive, repetitive behaviors, which again, remember we talked about that with the symptoms of ASD. When looking at the blue area, so this is made up of the amygdala hippocampus, the fusiform gyrus, and the orbitofrontal cortex makes up the ventral social affective processing system. You can probably guess by the name, is associated with social affective behaviors. And then finally, the green areas, your subcortical nodes, is the thalamus and basal ganglia. And these two areas, your subcortical nodes, are actually engaged by both the dorsal executive control system and the ventral social affective processing system. So your subcortical nodes are involved in both systems of the functional changes in autism. So let's talk about the dorsal changes in autism. So here we get, why is my computer doing this, guys? Here we see, no, sorry guys, my computer hates me. So here we see executive functions are altered in autism. So again, these are similar to what we've talked about in the previous lecture. So we see cognitive flexibility, planning, and preponent inhibition. Preponent inhibition just relates to impulsivity and the ability to resist an impulsive behavior or thought or whatever. And then we see executive functions are preserved in autism. So this includes rote memory as well as interference inhibition. So again, interference inhibition just relates to suppressing stimuli to complete a task or suppressing distractions. So again, we see this where they tend to get hyper-focused on one area and kind of don't focus on anything else. And then we've got alterations in function of the inhibition network. So this is the cingulate gyrus and insula uncoupled from the frontal parietal process. And then we also see effects proposed to occur through deficits in set shifting. And set shifting relates to the ability to kind of remove from one task and move on to the next. And autistic programs have deficits in tests of set shifting, so we see an increased propensity for errors and a slower reaction times in ASD patients. And then all of these are kind of supported from lesion studies. So again, these are studies done in animals. So we see damage to the frontal cortex will interrupt executive function. So an emergence of separative and repetitive behaviors, insistence on sameness and impulsivity. So again, we see this in the animal models, and as well as in the very few case studies of actual humans that do have damage to the frontal cortex, as well as ASD, but also just remember that is a very small number of humans that can be used in that, because it's very hard to find humans with a lesion in the correct area. So we also have some circuit changes in the set shifting test. So that's what I just talked about. So we do see hypoactivation in the dorsolateral prefrontal cortex, in the anterior cingulate cortex, the left interparietal sulci, the thalamus, as well as the basal ganglia. And this correlates with clinical manifestations of restricted and repetitive behaviors. So again, looking at that anterior cingulate gyrus and the left interparietal sulci, or sulcus. And so some studies will show hyperactivation of the circuitry, especially in higher functioning autistics. And this may be a result of compensatory changes as a result of reliance on alternative cognitive strategies. So because they don't have the normal cognitive strategies, or they haven't learned that as normal humans do, then they kind of have to change how they use their cognitive strategies. And so this can lead to the hyperactivation of this circuitry. We also have some ventral changes in autism as well. So here we see changes in regions involved in the social perception and cognition. So here, one of the main ones is the amygdala hypofunction. So this is suggested by postmortem structural and functional imaging, that we see underaction of the amygdala. We see increased activation of the amygdala observed in response to viewing facial photographs. So this shows the heightened emotional response to gaze fixation in autism. So again, why some autistic patients don't do eye contact, and why they kind of just stare at certain things. The fusiform gyrus is implicated in normal processing of social stimuli, so especially the faces and facial features. So we see hypo function of the fusiform gyrus observed in autism, which again makes sense because with less use of that fusiform gyrus, then we see those symptoms in some autistic patients. However, you do see an increased activation of the fusiform gyrus in response to viewing facial photographs. Again, this is kind of connected to this amygdala, that looking at faces does something a little differently in autistic patients. So when we look at social perception, which again is one of the, social deficits are one of the largest symptoms, or most talked about symptoms of ASD, then a lot of research has gone into looking at some potential differences or causes of this in the brain itself. So we do have here some specific changes in social perception. So normal processing is seen for place and object stimuli in autistic patients. However, we do see further hypoactivity of social processing areas. So this is the superior temporal sulcus and the occipital face area. So you can see this. So in blue is the objects you see as normal. Green is places, and then red is faces. And so this is showing in here in the A column, we have the typical or healthy patients, and then B is the autistic patients. And in both the typical and autism patients, then we see a lot of blue and some good green, saying that they're still processing these places and objects very well and in very similar areas to what the normal patients are. However, when you look at how they're processing faces, then we see that there are the normal patients, and we see red areas here in the superior temporal sulcus here, the STS, and the OFA, the occipital face area. However, when we then look over here to the autism patients, then we no longer see those red areas that are normally lit up in a healthy patient. There's a little bit of the OFA over here, but in general, there's a severe lack of that activity. So that's showing that hypoactivity of social processing areas. So we see this failure to engage the subcortical regions, which are involved in face detection. And then there are, of course, also some orbital frontal changes in autism. So we see bilateral damage to the orbital frontal cortex yields social cognitive impairment. In other words, if you damage that area, you get social cognitive impairment. And we especially see this in judging intentions of others, so what other people are meaning to do. And so we see functional changes observed in the orbital frontal cortex in social tasks in autism. So that's it for this video. In the next video, we'll continue with some connectivity and kind of how we can image the brain and to further understand autism.